Many, as we have been reporting and hearing from members of the public, the rollout has simply been too slow. The slow pace of vaccine acquisition has also seen phases 1 and phase 2 overlapping. Let's look at how things are looking in the various provinces. We'll be taking you around Johannesburg, also down to Durban throughout the day here on All Angles. But for the moment, let's take you down to Cape Town, where my colleague Nobosuthu Hejana is following that for us. Hello to you, Nobosuthu. So the Western Cape saying they're ready for a third wave. They're ready for a surge in numbers. How ready are they for a vaccine rollout?
Well, Gareth, they've increased their vaccination sites. 53 as of this morning or Monday have been added onto the vaccination sites in the province. We know that 6 vaccination sites have also been added in the rural areas. But when we spoke to Juanita Arendse, who's part of the provincial vaccination lead here at the Western Cape, she was telling me that they are ready to accommodate all the numbers, and their resources are in place. They will make sure that all the people are vaccinated on time. And here at Karl Bremer Hospital, there's quite a long queue of the elderly people who are here to get their jabs. And when we spoke to her earlier on, she did mention that even though that the number of people who are here, some of them they did get their confirmations, while others have not yet received those confirmation SMSs informing them to come here, but they will not be turned away. Instead, what they're doing here at the hospital, they have a separate queue for those who have not received those confirmations, and they will be assisted, but their waiting period would be slightly longer than those who did get those confirmations to be vaccinated here this morning.
Nobosuthu, I'm going to ask you to stay with me for the moment. I'm going to come back to you and talk about whether this is small-scale, large-scale or mass vaccination centres. But Heidi Jokos, you're with us as well as we bring you back up to Johannesburg here on All Angles. And you and I have been talking for some time about the lack of speed. Some saying, Heidi, the lack of urgency with the rollout. It seems the Western Cape, their big focus is vaccination centres. It seems Joburg still doesn't quite have a plan behind it, or is that overly critical?
Well, Gareth, we did speak to the provincial spokesperson, Mr. Thabo Masebe, just a short while ago, who indicated to us that they are expecting to ramp up the vaccine rollout program this week with additional sites and, of course, bringing in the private sector such as Dis-Chem and Clicks pharmacies to assist with rolling out the vaccine. But what's interesting here is the fact that we still don't know how many additional sites have been added to the province and where exactly these sites will be. When we asked the provincial spokesperson earlier, all he said to us was, we will know in due course. But what's interesting about the criticism that's coming from many saying that the province is already in its third wave, if there was ever a time, it is now that we need to ramp up the vaccine rollout. Gauteng is actually leading with regards to how many vaccines it's already administered from the beginning of Sisonke and now with phase 1B and phase 2. So we do know that the province received over 50,000 vaccines last week with Pfizer, and they've already administered over 30,000 of that. We do understand that also this week they will be receiving an additional 50,000. So they are expecting to be done with these 2 batches by the end of this week. This is according to the provincial spokesperson, because we do know that we need to ramp up the vaccine rollouts and, of course, try and move from phase 2 of the elderly and senior citizens to those that are over 40 and have underlying issues. So according to the province, they're doing all they can, but we do know that there has been much criticism. Even as a journalist, Gareth, I must add that we have truly been struggling to get key and critical information from Gauteng Health with regards to how many have been vaccinated under phase 1B. Those are the healthcare workers and support staff that were not included in Sisonke. Those details are not available to us. So hopefully this week, now that things have been, we've already been in week 1 of phase 1B and phase 2, we'll get more information and things will be a lot clearer and smoother in week 2.
Yeah, it seems to have been the biggest issue up in Gauteng is the lack of information. vaccination. Heidi, I'm going to come back to you now. I see you standing outside Mill Park Hospital. We'll talk about that. Nobosuthu, the reason I want to come back to you, I'm sure you would have just heard Heidi, it seems to be a very different story down in the Western Cape. It just took me less than 30 seconds to Google all the vaccination sites that are currently online in the Western Cape, which are active from today. So it seems that the government down there, as far as the Western Cape is concerned, communicating a lot clearer. Are you getting a sense, though, that this information is getting out to the public? What are people telling you?
Well, in fact, the MEC of Health in the province, she's out and about going with her programs to also educate and register the elderly people. But what we've seen in the Western Cape are a number of messages that have been shared on social media where people have been saying that people should go to certain hospitals in order to get vaccinated, but the department saying that those are not true, but it's hard to monitor such messages that are doing rounds on social media. But another thing that has been brought up are people who are able to register on the site and get approved even though they don't meet the requirements. But when we spoke to the CEO of Groote Hospital last week, or a week before last week, Dr. Patel, she was saying that when a person comes to the hospital with a voucher, they will be assisted with the vaccination, but they cannot verify if that person is on the required list or is either a healthcare worker, because when they come to the hospital, they do have that voucher. And they are also appealing to the public to allow those who are set or who are needed to be registering to get their vaccines to do so, but also saying that although they cannot verify everyone who goes to the hospitals, but they're appealing to the people or the public to respect the process.
Nobosuthu Hejana, for the moment, I'm going to say thank you to you. You can stay where you are for the moment as we just finish our conversation back up to Heidi Jokos in Johannesburg. More specifically, Heidi, outside a Mill Park Hospital. I know you can't see Nobosuthu, but I'm seeing queues of people standing behind her. It looks like there's social distancing and masking up. All I'm seeing where you are is buses and cars driving in and out. Give me a sense of what's happening at Mill Park.
So we do know that Mill Park was a vaccination site under the eNCA trial, and we do know that according to management here, we spoke to them a short while ago just to get a sense of how things are unfolding here. We know that this has been a vaccination site identified for phase 1B. When I asked the question with regards to what happens with phase 2, will they be vaccinating the elderly and senior citizens, we were told they are still waiting for further communication from the national department, which is something that we also saw at other vaccination sites. But there are a number of vaccination sites, Gareth, that I must say that we were at last week where there were long queues. People were getting the vaccines. For example, at Chris Hani Baragwanath vaccination site, they actually do accept walk-ins, even if you don't have a voucher number but you're eligible, you're 60 plus, or a healthcare worker or support staff, and you don't have a voucher, they actually do accept you as a walk-in because they are trying to vaccinate as many people as possible. Just quickly looking at Gauteng province last week, we know that there were over 24 vaccination sites and 11 old age homes that were targeted. I cannot give you the number as to how many vaccination sites are being prepared for this week. We do know that they are trying to ramp up. But when we spoke to the provincial spokesperson earlier on, he said that he was unable to give us the number of vaccination sites that are being prepared for this week. But they'll soon be updated on that list that we all have for the province, either today or in the coming days, as soon as those vaccination sites are ready. But it's critical for the private sector, such as hospitals like Mill Park, Dis-Chem pharmacies, Clicks pharmacies, and even Discovery, to come in to assist with the ramp-up of the vaccine rollouts as the province is already in its third wave.
It is indeed. Heidi Jokos for the moment making sense of what little we know about communication as far as vaccine sites are concerned. She'll be continuing to speak to officials and demanding those answers. It's critical we know when and where these vaccines will come up. Heidi Jokos in Johannesburg for us. Also my thanks down in Cape Town to Nobosuthu Hejana. We'll continue to crisscross the country throughout the day here on All Angles and on eNCA as we stay on Vaccine Watch. Coming